looking to connect a region of over 600 million bridges between our lands.
Hello and welcome to ASEAN in Focus. I'm Alma Angeles, and welcome to our special coverage of the coronavirus situation around the world. On today's headlines, the new coronavirus pandemic is clearly accelerating. That is according to the World Health Organization. And Thailand declared a nationwide emergency. And later, we'll get more updates on the coronavirus situation from different parts of the globe. That will be in Malaysia, in Thailand, in Cambodia, Sydney, Australia, New Zealand, American Samoa, in Las Vegas, and in New York. The new coronavirus pandemic is clearly accelerating, the World Health Organization warned. Despite wanting to go on the attack, the WHO chief acknowledged that a number of countries were struggling to take more aggressive measures due to a lack of resources and access to tests. Let's listen in.
From almost every country in the world. That's heartbreaking. The pandemic is accelerating. It took 67 days from the first reported case to reach the first 100,000 cases. 11 days for the second 100,000 cases. And just 4 days for the third 100,000 cases. You can see how the virus is accelerating. But we're not prisoners to statistics. We're not helpless bystanders. We can change the trajectory of this pandemic. Numbers matter, because they're not just numbers. They are people whose lives and families have been turned upside down. If we don't prioritize protecting health workers, many people will die because the health worker who could have saved their lives is sick. As you know, WHO has been working hard with many partners to rationalize and prioritize the use of personal protective equipment. Addressing the global shortage of these life-saving tools means addressing every part of the supply chain, from raw materials to finished products. Measures put in place to slow the spread of the virus may have unintended consequences of exacerbating shortages of essential protective gear and the materials needed to make them. Solving this problem requires political commitment and political coordination at the global level. This week, I will be addressing heads of state and government from the G20 countries. Among other issues, I will be asking them to work together to increase production, avoid export bans, and ensure equity of distribution on the basis of need.
All right, Malaysian authorities have arrested 28 people for defying the government's movement curbs. Now, as you can remember, Malaysia had the army to support police in enforcing tough restrictions to halt the spread of the coronavirus. And people have been told to stay at home, and all schools and most businesses have closed, while Malaysians are barred from traveling overseas and foreigners from entering the country. But some have been ignoring these measures introduced this week. And we have more update from our EBC correspondent in Malaysia, Ruby Tinawin. Ruby?
Yes, over here in Kuala Lumpur, Malaysia, here's the update. The Malaysia's Prime Minister Muhyiddin Yassin has again extended the restriction order until April 14. The announcement was made just an hour ago as a result of extension because of the continuous effort to actually contain this virus. Now, in his announcement, a few items were mentioned. Number one, he mentioned to all Malaysians that we need to be mentally and physically prepared because the lockdown can extend further if the condition is not going to improve. Now, he also mentioned that nurses and doctors and all the professionals in that line who provide all the first-hand support to contain this virus are given time to rest. However, he also urged all charity organizations to rise up and to start helping out those who are in need. Now, in his announcement, he mentioned as well that more than 95% of Malaysians have followed the rule imposed by the government in the past 2 weeks of lockdown, which is stay at home, do not go out unless it's really necessary. However, deaths continue to increase, and as of today, in his speech, he did mention that 17 deaths. As compared to yesterday, that was only 15. Now, most of this, like as of yesterday's news, the 106 cases yesterday, 43 were linked to the Muslim religious gathering, according to the Ministry of Health. And whereas 64 patients were admitted to intensive care units and 24 of them were on ventilators. Now, what was highlighted is the fact that most of those death cases were actually linked to the religious gathering, or what they call Tabligh cluster that happened a few weeks ago. And so the government is still trying the very best to contain and to actually conduct as many tests as possible to resolve this issue as fast as they can. Meanwhile, the Kuala Lumpur City Hall, there is the requirements for all workers, those suppliers, customers of supermarkets and restaurants to wear face masks while on the premises. This relax also, the requirement is also to relax, the imposition of a strict ruling that they should have hand sanitizers. It is encouraged, but it is not mandatory, simply because there was some kind of concern because there's a shortage of masks and shortage of sanitizers in Malaysia, and not only in Kuala Lumpur but all throughout Malaysia. And believe it or not, there's really a spike of prices of masks and sanitizers and all other goods related to because as a result of this outbreak. Now, at the airport, there are thermal scanners that are already been installed in both the airport, because in Malaysia we have these the main airport, which is the KLIA, and we also have KLIA 2, they call it. So both terminals has installed thermal scanners as well, and the screening of passengers, the thorough screening of passengers started on 23rd of March, and it will continue to happen until further notice. Now, they still stick to measuring, making sure that your body temperature is below 37.5 degrees Celsius before you are allowed to proceed beyond the screening area. Now, similarly, all the LRTs and all the trains, they cut down. They are still operational, but they cut down their operating hours to 9 hours per day. And that is starting today. Starting today, they made an announcement. Express Rail Link has announced that it will start to reduce operational hours in order to comply to the recent directive by the National Security Council due to the ongoing movement control order period. So for how long will this be in effect? As a result of the latest announcement by the Prime Minister, we have yet to know. We should be able to give update as soon as we get all the information. Now, what is to be decided right now is because the lockdown is extended for another 2 weeks. School holidays is ending this week, and children are supposed to go back to schools next week. And up until now, they are still coming up with alternative actions, how the primary school kids and high school kids, especially those who are in public schools, are able to continue their studies. Now, also, the rest, like those work from home, are still in effect. Those professionals working in the front line, those who provide essential services, they continue to work back in their offices. They are not really work from home mode until now, but we'll see how the situation progress, and we wait for further announcement. Meanwhile, how people here entertain themselves. There's one part in Kuala Lumpur where residents of apartment block, they actually put up nightly public light shows to entertain themselves during the COVID-19 lockdown in the area. Because as we reported yesterday, the Kuala Lumpur area, four districts in Kuala Lumpur are on the red zone. That means most of the COVID-19 cases were identified from those places. Yeah, so the restriction is still there, and the fact that the lockdown is extended, a lot of concerns. But again, the positive note is family bonding is still happening. You still have the chance to stay with family, catch up with them, and all other things that probably you have not done before. Now you have more time to work on it yourself. Okay, Alma?
Okay, Ruby, can you tell me how fast is the spread or the recovery of the coronavirus in Malaysia?
For now, if you look at the statistics, at present we have a total of 106 new cases. That was yesterday. So the additional 2 that was announced today, that brought to 108 new cases, bringing the total to 1,626. The death toll is 17. That is high. So the if we were to compare, the death is still being recorded almost on a daily basis. The number is single digit, but almost on a daily basis. Recovery is not that fast, but they are trying to contain because in Malaysia the main problem is the infection is not. Those people who were infected by the virus were not the main carrier. So they were the ones who were, who were infected by another infected person. So there was speculation that the amount or the total number of people that will be affected here or infected here will really be a lot. And that's why the Prime Minister said definitely there is a, if the need be, then we will further extend the lockdown.
Would
Now,
you?
in
Yeah.
relation
Sige,
to
go ahead.
that,
Go ahead. Yeah.
yes, Alma?
No, go ahead. Go ahead. Okay.
Okay, in relation to that, there were many support that is being established, including the National Bank of Malaysia. They are working out on some kind of support system to actually aid those people or organization were affected by COVID-19 virus, whether directly or indirectly. And they were also looking at, like, for instance, for all the residents, our national electric company here, PNB, they made an announcement that a 15% discount will be given to all the residents from April up to June in terms of paying your bills. So I think that's very helpful, because the fact that we stayed at home, like for 2 weeks and then another 2 weeks, means that your electricity consumption is also a lot. And many more will also join, because all these government agencies are working together, trying to find a way on how to ease the burden on the part of the people here. Alma?
How would you say this emergency compared to other emergencies
Can you
in
repeat that?
Malaysia has experienced?
Can you repeat that? It's
Yeah.
not very
How
clear.
would you say this compares to other emergencies in this country has experienced?
I see that here everyone is very attentive, starting from the government. They are very proactive. If you notice, the lockdown is actually until 31st of March, that is next week. And the people in the government, those from the health ministry and also from the prime minister's office, they are really monitoring the case very closely. That includes the security department and everyone in the community area, because all local governments are also providing reports. In fact, we receive messages on our phone from the security department giving us updates. And that happens almost on a daily basis. So if you talk about how they respond to this, I think they're very proactive. They're really trying their best. And that pacify a lot of people here. So the panic is not much on, knowing whether there's groceries in the supermarket. But now it's like, staying at home for another 2 weeks. So what are we going to do? Alma?
Okay, that's good. You have more time for yourselves, for the family. Thank you so much for your update, Ruby. And yes, we'll be following this developing story in your country. Thank you, Ruby.
Okay, reporting from Kuala Lumpur, Malaysia, this is Ruby Tinawin. We live in interesting times.
Over in Thailand, the government just approved a 1-month state of emergency, allowing it to impose stricter measures to control the coronavirus. However, in a brief televised address, Prime Minister Prayut Chan-o-cha assured the country that he is not instituting a lockdown yet. Is this true? We have an update from our EBC correspondent there, Faye Barte. Faye?
Hello, Alma.
Hello,
Good afternoon,
Faye.
everybody. Good afternoon, Alma.
Good afternoon. How are you?
Yeah, I'm still okay. Actually, a lot of people here in Bangkok, Thailand, doing the work from home, and because Alma, Thailand found 107 new COVID-19 cases. And the total is now 934 cases. Alma, this is quite alarming because not as I've said yesterday, it was not just 2 digits was adding. It is already 3 digits. So like hundreds of patients, hundreds of people are having the COVID-19. So it's really quite alarming for everybody, Alma.
So the Prime Minister just declared a state of emergency. So what are the Local and national governments, what are the what measures has your local and national governments undertaken to lessen the spread of the coronavirus there?
Yes, Alma. The government plans, so they are still planning to announce the executive degree on public administration in emergency situations on Thursday. So that would be tomorrow, March 26, 2020, in an effort to effectively control the spread of the coronavirus disease 2019. So that is the COVID-19. Prime Minister and Defense Minister General Prayut Chan-o-cha stated that after the announcement of the national state of emergency, the COVID-19 center would be upgraded to the COVID-19 emergency centers. Emergency centers. Alma, a lot of people here, Filipino and other nationalities, especially locals, are preparing for most serious protocols or serious rules that we're going to follow. And a working community will be formed, and it will hold a meeting at 9:30 every day. Permanent secretaries of various ministries will be assigned to follow up the progress of measures to deal with the COVID-19 situation. And they are going to propose new measures to the committee as well. And the Prime Minister Alma said that requirements might be announced at all times to minimize the spread of the virus in various areas of the country. Some measures call for cooperation from the public. And he also said that various measures imposed by the government were necessary for the sake of the public health, and people have been urged not to return to their hometowns now. Because Alma, that is, Prime Minister is addressing that, and the Prime Minister is asking for the cooperation of everybody, especially the locals, because they have Bangkok is still on a partial lockdown. However, the people, the locals are urging to go back to their hometowns, and then Prime Minister is asking them just to stay in Bangkok for a while, for a couple of weeks, because that would help to contain or to not to spread the virus here in Thailand. And another Alma is for for that, the Prime Minister also urged the people not to panic, but to follow up on news and information from the government. During the enforcement of the executive decree on public administration in emergency situation, the public must be careful about what they post on social media channels. They must not disseminate fake news and information. Anyone abusing social media will be punished. And another thing there is the government is preparing more places in hospitals as well as field hospitals to accommodate COVID-19 patients. Large quarantine areas and more pharmaceuticals will also be acquired. And another information there, Alma, because Bangkok is still on a label, it's still on its label partial lockdown. There are some provinces here in Thailand that already declared by their governors a total lockdown. Example for that is Buriram and Phuket. Phuket have already announced by Mr. Pakapong Tawipat, their governor, that there would be a total lockdown because all the locations, all the places there in Phuket is labeled as all at risk. So the lockdown would be up to March 31 because there are 9 new cases that has been added to it. Alma?
You mentioned about the hospitals being readied or being prepared. Are the doctors and nurses going to be provided with enough protective equipment? Do you think you have enough over there in Thailand? Are you ready over there?
Yes, Alma, because the government here, while they are preparing for more hospitals, more accommodation for the patients, they are also preparing lots of gear that they may use to cure this COVID-19 cases patients. They are having enough gear, or what we call hospital equipment, hospital things that they can use for the frontliners that they are going to hire.
All right. Thank you very much, Faye. And you do take care, and we'll wait for more updates from you over there in Thailand. Thank you.
Thank you very much, Alma. Thank you very much, everyone. Also, this is Faye Barte. These are the updates from Bangkok, Thailand Bureau. We live in interesting times.
Thank you, Faye. Let's go over now to Cambodia. Prime Minister Hun Sen ordered all provincial governors to take immediate and urgent action to turn hotels and education institutions into standby facilities to treat people with COVID-19. And aside from that, we have more updates coming in. Joining us live right now is Crystal Ann Ballesteros from our EBC Cambodia Bureau. Crystal Ann, what do I call you, Ann? How are you?
Yes, you can. Hi, Alma. Good afternoon to everyone. I'm okay. I'm still at work.
Oh, you're still working. Okay, that's good. So,
Yes.
you're still allowed to go to work, no lockdowns, or are you on partial lockdown right now?
Well, actually, Cambodia reported a total of 87 cases as of yesterday. That's what the health ministry said.
Okay.
Ministries and sectors of Cambodia are ramping up efforts against the COVID-19 pandemic as the number of infection cases in the country had reached 87. No lockdown and panic buying. Masks and sanitizers are quite needed and the price really increased. Prime Minister Hun Sen ordered all provincial governors to take immediate and urgent actions to turn hotels or education institutions into standby facilities to treat people with COVID-19. Prime Minister also ordered authorities throughout the kingdom to use temporary closed schools as makeshift hospitals and has told relevant officials to prepare facilities there for the treatment of COVID-19 patients. Many hotels also are closed as of now, Alma, and they don't have guests. So those hotels which are already fully equipped need to be rented to prepare for patients, adding that if there are no hotels available, public schools and vocational training establishments could be used to accommodate patients. And regarding with the borders, Alma, Thailand and Vietnam borders are closed coming to Cambodia. However, the trade between Cambodia and Vietnam is expected to continue as normal despite new border control measures due to the COVID-19 pandemic. And a Vietnam embassy official in Cambodia told the Phnom Penh Post that Vietnam has restricted the movement of people across the border with Cambodia to stop the spread of the coronavirus. But trade between the nation continues.
Okay. So, do you have enough supermarket, grocery supplies over there? Is there any panic buying over there?
For panic buying, there's no panic buying as of now, Alma.
Yes, you said.
And
Yes,
the things that the citizens needed are just mask and sanitizer, which are the prices really increased.
Wow. So there's no lockdown. People are still free to go outside. I mean, what measures have? Yeah. Okay.
There's no lockdown, but the schools are already closed, and then some of the companies also are working from home. But it depends on the company.
Okay. So is there enough food available at the markets?
Yes,
there's no panic
but
buying.
some of the markets are already closed because they are scared of the virus.
A lot of
But
them?
the Prime Minister informs the citizens to relax and don't panic, but still do preventive measures to make sure everyone is safe.
So the people over there, the mood now is panicky. Is that what you're saying?
Some of the people are panicked, but most are calm because of the Prime Minister is giving right actions in order for us to prevent this virus.
Have curfews been implemented there, just like here in the Philippines?
No, not yet. None so far.
Okay, that's good. Okay, so what positive thing do you see out of all this? I mean, it's not really yet felt that much felt over there, but what positive thing can you get out of all this? Do you think?
I think the positive thing is that the Prime Minister really do his best to make the people or the citizens of Cambodia calm, even though there are some businesses who's already closed, and uh, the tourists are going down also, because in Cambodia they have a lot of tourist destinations, and also the airlines are uh, almost closing down, but still the Prime Minister remain calm and make sure that the citizens will be okay even though there's a virus.
All right, thank you so much. Thank you so much, Anne.
Thank you so much, Alma. This is Crystal from Cambodia, and we live in interesting times.
Okay, let's go over to Sydney. According to the Australian government, the Department of Health there, as of 6 a.m. on March 25, there have been 2,252 confirmed cases of the coronavirus COVID-19, and there have been 429 new cases since 6 a.m. yesterday. Let's verify that and get an update from our EBC correspondent in Sydney, Australia, Diana Pedro. Diana, how are you?
Hi, Alma.
Hi, Diana. How are you?
Hi, Alma. I'm very good. Thank you. And yes, what you said was right. Let me just repeat that. As of
Yes.
6 a.m. today, 25th of March, there has been 2,252 confirmed cases of COVID-19 here in Australia. That was up by 429 since 6 a.m. yesterday. The highest number is recorded still here in New South Wales at 1,029. And this is followed by Victoria at 411 and Queensland at 397. And so far, we have a death toll of 8. The latest casualty just yesterday is a female in her 70s and was a passenger from the Ruby Princess cruise ship, which was allowed to disembark here in Sydney last week. And in fact, Alma, from that same cruise ship, more than 130 passengers already contracted coronavirus. But on a lighter note, despite that we have 8 deaths so far, we have 118 people who have recovered. So that's something positive. And to mitigate the spread of the virus, as you may have heard, non-essential businesses were required to shut down in the past couple of days. Additions to that list that took effect from midnight today, and they call these stage 2 restrictions, are shopping center food courts except takeaways, beauty salons, auctions, non-food markets, museums and galleries, and play, recreation, and sports centers. Appointments with barbers and hairdressers are allowed, but with a 30-minute limit. Boot camps and outdoor personal training are allowed, but limited to 10 people. Weddings are limited to 5 people, and funerals to 10 people. The government also placed a ban on overseas travel for Australians, except for aid workers and important government travel. Schools remain open, and the government is meeting with the Australian Education Union on the next steps. Meanwhile, as you saw in the videos, we see a significant decrease of beachgoers to one of Sydney's most famous tourist destinations, Bondi Beach. Just a few days ago, Alma, a viral photo of the beach circulated on social media, filled with people, business as usual, as if there's nothing going on. But now it looks like the Aussies are starting to take the government's warnings more seriously, which is a good thing. That's it now for Australia. Alma?
Over there in Australia, Diana, how is the government of Australia taking care of its health workers at the front line? Do you have an idea?
For the health workers, it's not any different compared to other countries. So they're providing personal protective equipment, and then they're making sure that the health workers are covered in terms of benefits. And in general, also, the government is taking very good care of the country's workforce. So it has announced just a few days ago that it's going to give additional incentives to people who are going to lose some business or lose their jobs because of this pandemic.
How would you say this emergency compared to other emergencies that your country has experienced?
This pandemic is
yeah. Okay, go ahead.
Yeah, this pandemic is of massive proportions. If you remember, Alma, we just survived the massive bushfires that we had by the end of last year, and then now we have this, and although the bushfires were, I would say, localized in certain regions, this epidemic is felt by everyone. So as an example, as I mentioned, employees are losing their jobs, and although the government is giving them incentives, these people who lost their jobs, they're responsible adults. They haven't had to ask the government for help before, and now they have to do that. So they're a bit embarrassed, but it is what it is, and luckily the government is ready to back us up.
Have curfews been implemented there as well?
No, there are no curfews. We could still go out to buy essential supplies if we have any appointments to the medical centers. If we have to work that we cannot do work from home, we're still allowed to go out.
Okay. What positive thing can you see out of all this as a final word, Diana?
I think I would say in general the Australians are really taking good care of their neighbors. So there was one news that I saw earlier because the toilet tissue rolls here, we're losing stock of it. So there are people who have lots of stock in their homes, and then they're giving it away.
Oh, that's nice. Oh, what about food? Do you have enough supply in the supermarkets?
Yeah, we still have enough supplies of food, yeah.
Well, in the US and the UK, no, there have been occasions when the population failed to heed the government calls for self-quarantines. Do you have any similar incidents there?
Yeah, we had it in the beginning. So the beachgoers to the Bondi Beach, that viral photo, that was one example. But slowly people are getting it. They're starting to follow the government's instructions.
All right. Thank you very much, Diana.
Thank you, Alma. And this is Diana Pedro from New South Wales, Australia. We live in interesting times.
Okay, let's go over to New Zealand. The state, it's now in a state of national emergency. New Zealand is preparing for lockdown from 11:59, March 25. We have an update. Okay, let's go over. Okay, we have Evelyn Vivas on the line joining us live right now. Evelyn?
Hi, good evening, Alma. It's now 7:30 here, 7:30 p.m. here in New Zealand. And yes, you're right. In just a few hours, we will be on the level 4 alert. It's an alert measures by the government to protect us from COVID. And at 11:59, you're right, we'll be on lockdown, and which means that, and actually this afternoon, the government declares a state of national emergency, and in a few hours, the whole country will be at level 4, which is a lockdown. In fact, at 6:30, this afternoon, all all our mobiles, we receive an emergency email alert from the National Defense. This is all mobiles in the whole country, and receiving reminding us that in just a few hours, we will be on a lockdown. So therefore, we need to be responsible, and staying home means we love each other, we love our friends, we love our countrymen. So staying home means saving lives. So as at 6:30 as well, we received that it's about 207 now who is positive with COVID. So from 2,359 tonight, from 2359 tonight, all travelers will be subject to additional screening at our borders. Depending on their circumstances, they may be isolated in a government-approved facilities if they don't meet certain criteria. There will be operational implications for those people working in customs, because they need to be really screening all travelers coming into New Zealand now, and these are all New Zealand citizens and residents only. So it really came really very fast, and this is the very first time that New Zealand had encountered this kind of pandemic. And everyone is really very helpful, and everyone is cooperating, and because everyone really helped when they said distancing. If you look at I was in one of the biggest supermarket a while ago, and I could see that people, they're wearing their masks and they're doing this distances, physical distancing to each other. And fortunately for New Zealand, you will see they're panic buying, but not really, because they're just normally buying what they need, and we have a lot of stocks in our shelves. So it's just we keep on refilling. I mean, the people working on the supermarkets are keep on refilling all those items. So when it comes to like toilet tissue, we still have it. Food, we still have it.
Okay.
So as far as the government support, the government's really good, because they've opened up all the support when it comes to calling their GPs, when it comes to, of course, safety is the priority for the government. So safety of everyone is the priority, their health and safety. And this extends to the mental health as well. So we have the open phone lines wherein you could talk if you want to talk. So things like this has been set up by the government.
You said health services. This is the first time that you're experiencing this kind of pandemic. But are the doctors and nurses be provided with enough protective equipment? Do you have an idea?
Yes. We are provided with the PPE and the necessary that we need. In fact, there is to New Zealanders, are those who are in essential service, they still need to work, and a support are always there. And when in terms to, like, of course, nurses who have small children, because childcare, they're now locked down. I mean, they're all closed. Restaurants are closed, and the only opens are like pharmacy, petrol station, and dairy, and of course supermarkets. So these are all open. And in terms of support to especially those nurses and child and healthcare office who have a healthcare profession, when it comes to their kids, there is an open child care for them. Like someone will look after their kids. So it's been arranged, as long as they abide with the social distancing and all those kind of like hand washing. You need to wash your hand frequently and use the necessary guidelines that was given by the government. Okay. So when it comes to going out during the lockdown, of course, the police are all over the place. So, of course, to look after us, not just to like ask whether why are you out here. So if you said you're going to the doctor, then it's all right. There are some guidelines that's been given, and the alert system that's being sent by the National Defense on all mobile numbers, all mobile phones. So we received that alert like 3 times from 6 o'clock now, and it says there all the necessary guidelines that people need to do and
Okay.
follow. As what the Prime Minister said, following the guidelines means saving the life of the people you love in the future.
Thank you, Evelyn. And we'll see. We'll get more updates from you on how the citizens are coping with the guidelines. Thank you so much, Evelyn, for your updates there from New Zealand. Do
Thank
take
you,
care.
Alma. This is Evelyn Vivas from Auckland, New Zealand. We live an interesting life.
Okay, let's go to American Samoa from our EBC correspondent, Arian Torres, and her updates. Arian, how are you? Hello, Arian.
Hi, Alma. Good afternoon there in the Philippines and Talofa, and good evening here in American Samoa. I still have a good news for everyone that American Samoa is still COVID-free as of today, March 24, 2020, American Samoa Standard Time. And we're still on Code Blue. Code Blue means minimal social disruption with an emphasis on social distancing, hygiene, and health etiquette. That includes travelers from affected foreign countries will subject for 14 days quarantine. Returning resident must show a proof of American Samoa residency ID. ASG employee will work 4 days a week with 10 hours a day. All of island referrals to New Zealand are suspended. All public and private school, daycare, and ASCC or American Samoa Community College will be closed for the next 30 days or further notice. And all businesses will be allowed to operate from 6 a.m. to 6 p.m. only. And the second threat is Code Yellow with 1 confirmed case in American Samoa with code. This code will heightening restriction to slow the spread of the disease within the territory. And the code red is in the event of severe spread of the disease locally, major protective measure will be imposed. And this declaration will take effect for 30 days and will expire on April 17, 2020. And we have a developing story regarding those suspected cases of COVID here, since like what I've mentioned before that American Samoa doesn't have any COVID test kit. But here are the adjustment or what is the DOH is doing, alternative ways that they did. So the Department of Health has sent off island for testing a swab from a woman who is being quarantined at home. The woman, a local resident, had traveled to New Zealand, then spent 14 days in quarantine in Samoa before arriving here on March 14. Dr. Ifili John Tufa, Department of Health epidemiologist, said 2 days before she traveled to American Samoa, she developed a cough and a slight fever, which was not noticeable. However, she was isolated at home and DOH team have been visiting her every day. Dr. Tufa explained that the woman and her entire family has been in isolation at home and she is recovering well. She should be finished with with self-isolation in few days. In the meantime, Department of Health has sent a swab of the woman to CDC in Atlanta, Georgia, to be tested for coronavirus. The swab left last Thursday flight, and upon arrival in Honolulu, it were repacked and sent to Atlanta. Dr. Ifili says the test results should be known in 3 to 7 days after it arrives at the CDC headquarters.
Okay.
And
Ariane? Okay. Ariane, okay. So we'll get more updates from you. I'll see you back at the Ingo News International at 9 p.m. tonight for more updates.
Yes.
And we'll
All
get
right.
and the student that you talked to. We will be waiting for that. Thank you so much for joining us.
Yes, thank you, Alma, and see you for the full report of
Yes.
update of COVID here in American Samoa. This is
East.
Arian Torres from American Samoa, Eagle News. We live in interesting time. Thank you, Alma.
Thank you, indeed we do. All right, the latest information on the coronavirus situation in Las Vegas. Joining us live is Anna Cui. Anna. Hello, Anna.
Hi, Alma.
Hi. Thought I lost you there. How are you?
I couldn't hear you. Good. How are you doing?
I'm good. So what
I
is the
wonder if
latest
you're
over there in Las Vegas?
in Las Vegas. Yes. So today, according to the Southern Nevada Health District, there are now a total of 249 reported cases of COVID-19. That's almost 100 more cases compared to yesterday's number. And also, sadly, we have 2 additional deaths today as well, brings us our total to 6. Out of that 249, 65 are reported currently hospitalized right now. And I just want to point out that out of that 249, 50% of them actually falls into the age group of 18 to 49 years old, compared to 22% of those who are 65 years old and above. So hopefully, that validates the myth that only 65 and above can contract the disease. At least for our numbers here, I can say that. And so more measures are being done for our seniors here in Las Vegas. As with other places, they can go do their grocery shopping more in the morning. More and more stores are reserving that special time for them. And then also more and more stores, you see lines because they're limiting the number of people that can go in at one time. So that's good news. From our local government, Governor Sisolak today signed another emergency directive related to public gatherings. Last week, in one of our updates, we reported that he announced the limit of 10 or more people gathering indoors. So today that's been extended to including outdoor activities. So, public parks, playgrounds, volleyball courts, basketball courts, those are also being mandated to limit the gathering of 10 or more people. Now, he did emphasize that it doesn't include, families or households that have 10 or more people. Also, if those of us who are still working, of course, if you're working for essential businesses with 10 or more people, that's not included. In addition, he signed an emergency regulation promoted by the Board of Pharmacy here in Nevada to limit the hoarding of the 2 drugs that we've heard a lot of lately, which are the chloroquine and hydroxychloroquine, which are being used in clinical trials. He did say that he stressed that since there are no conclusive evidence that these 2 drugs are effective to treat the COVID-19 disease at this time, we want to be able to reserve them for those who really need it. So he did sign that regulation that, to limit the hoarding. And the police department, Las Vegas Metro Police, are also doing checks on the businesses that are non-essential businesses that are remaining open. They started that 4 days ago. So more and more they're encouraging, if you're a non-essential business, the message is, is so clear. It can't be any more clear, closed down. Everybody should just do the part of staying home, because that's the only way that we are going to mitigate the spread of the virus. So, general here, the most drastic change that we've seen is at the Las Vegas Strip. There's really hardly anybody there. Security guards you can see in most of the properties. Police cars, you can see them everywhere up and down the Strip to make sure that no looting or no criminal activities will happen. But in the smaller communities, as like for myself, I still have to go to work. We are working on more businesses are going into remote working for those who have the capability. We're also going to be going to do that starting next week. But for me, in the smaller communities outside of the Strip, I still see a lot of cars out on the road. I see a lot of people walking outside, although they do say that's good, to be outside, take a walk. That's one of the positive things that we're seeing. People seem to be doing more, exercise outdoors. But hopefully, our local government here, Governor Sisolak, is really proactive. So he's responding to, that's why testing is so important, because that's the only way that we're going to know, the situation. So as the numbers grow, more restrictions are coming up. And of course, the call to the public is to just adhere to the regulations, listen to the local government. Everyone, is encouraging everybody to just follow, because the sooner that we do that, the more that we cooperate, and the sooner, hopefully, that we will, see a decrease in number and go back to some normalcy here in Las Vegas.
Thank you very much, Anna. I would like to ask you some questions, but
Sure.
I wish we had more time, but I will be asking you later tonight at Eagle News International. I'll see you back for more updates on your area in Las Vegas. Thank you so much,
Sounds
Anna.
good. Okay.
I'll see
In
you
Las
back.
Vegas, Anna Kui, Eagle News, we live in interesting times.
To New York now, home to more than 8 million people. It had 157 deaths, some 15,000 cases of COVID-19. Let's get an update from our EBC correspondent there, Tenny Sumagi. Tenny, how are you?
Good. Living in interesting times.
we are all living in interesting times.
Yeah.
Extraordinary times as well, yes.
The total number of deaths in New York City has risen to 192, and there's a total of 210 deaths in New York State. So that's as of Tuesday evening.
So how is the government taking care of its health workers over there? The frontliners, our frontliners.
Well, they're the heroes at the moment, and they're really promoting that everybody in New York City to stay home. So there's all these hashtags, save lives, stay home, going around New York City's Link New York City kiosk, which is the Wi-Fi communication board that we have in New York City. Plus, it's very emphasized in the news that everybody should stay home, and it's plastered all over social media, on people's pages, saying for New Yorkers to please stay home.
Do you have other measures in place taken by your local government or state undertaken to lessen or halt the spread of the coronavirus?
Well, in New York City, our subway system, the MTA, already cut services on 3 lines, the B, the W, and the Z train, because already 52 MTA workers have been tested positive. So that's a main concern in New York City. Also, Mayor de Blasio is considering closing New York City parks. Will probably be notified by Saturday.
Okay. Anyone who traveled or passed New York needs to be quarantined for 14 days. Did you say? Yeah, you mentioned that too.
Yeah.
Okay, so what about curfews?
Curfews aren't implemented, although businesses, it's been mandated that New York State businesses close by 8 p.m. with the exception of pharmacies and supermarkets. But like I have said, it's been emphasized that all New Yorkers please to stay home and self-quarantine. And I would have to say that a lot of New Yorkers have been, I'm sorry, lost for words.
Go ahead.
It's late, okay? That they're abiding with the laws.
Okay. So there have been occasions there in the U.S. when the population refused to heed government calls for self-quarantine. So have there been, what other similar incidents that happened there? And what did the government do to clip, to clip that?
In New York City, they're not stubborn like Florida people.
Oh, okay.
They're very cooperative because I believe that New York,
okay.
everyone's scared and in a panic. They're taking this very seriously.
So you have enough food available there? Supermarkets?
Oh, definitely. Yes.
Takeouts?
I think everybody's more in search of Lysols, hand sanitizers right now. But food is actually everybody won't starve here.
Okay. All right. Thank you so much. I wish we had more time and ask you more questions, but I know we have a lot of days ahead to to talk. All right. Thank you so much, Tenny Sumagi.
In New York, Tenny Sumagi, we live in interesting times.
Thank you, Tenny. All right, and that is our news for today. We'll see you back later. I'm Alma Angeles, and we live in interesting times.